Thank you, ma'am, for your very kind introduction, and thanking the principal also for inviting me to give this talk. So it's a passion for me. I really love talking about preventing heart attacks. The reason is you can prevent and predict 90% of heart attacks. It's a man-made disease. So there are still a lot of populations in this world that do not have heart attacks at all. No one dies of heart attacks in those small sets of populations. But in the majority of the world, it is the number one killer. And the number of people succumbing to heart attacks are much more than all cancers, every other disease put together versus heart attacks. Heart attacks kills more people. In India, the situation is even worse. Right? Heart attacks happen in India 20 years at a younger age than in the other populations. So if you look at statistics, people see TV nowadays and say, oh, a lot of young people are dying. It was always like that. So almost half of all heart attacks are in people less than 50 years. So they are either in their 30s or 40s. 1/4 of all heart attacks are in people less than 30 years. Or in their 30s, less than 40 years, sorry. So it is so bad, which means this disease, which is a killer disease, is attacking Indians at a very young age, in their prime, when they are the main earning member for their family. I have seen innumerable families where the main earning member dies of heart attack, and then the children don't have money to educate themselves, and it becomes very bad. So I always think, why can't we prevent this? Why can't, when we know how to prevent it, why are we not able to do it? There are 2 or 3 reasons. Number one is people think heart attacks are a very treatable disease. A lot of people tell me, మీ ఇంటి పక్కనే ఉన్నామండి, మీ హాస్పిటల్ పక్కనే ఉన్నామండి. Statistically, half of all heart attack deaths, people who die of heart attacks, die before they reach a hospital, even in the best countries. So you are talking about only the rest of the half. The rest of the half, you have to open up an artery, the arteries that are blocked, that produce heart attack, you have to open it up within 4 hours of the onset of chest pain. Otherwise, the muscle is permanently damaged. Okay? So it is a very difficult disease to treat. Everything should be perfect. Then only, some people survive. Otherwise, the majority die if they have to die because of a heart attack, they'll die. So basically, we have to concentrate on prevention, not on the treatment part. So if you look at it, you can predict 90% of heart attacks by simple risk factors. All of you know them. Mental stress, what we eat, the exercise that we don't do, diabetes, high blood pressure, high cholesterol, lack of sleep, things like this, which all of us know. Then why are we not able to prevent it? The reason is we do not know how to prioritize things in life. And this is even more true in developing countries. See, in developing countries, for example, my parents, for them to give me food, shelter, and some education is enough. They struggled all their life to just do that. For many of us also it is like that. We are continuously working in a rat race, and we don't give enough time for ourselves. Failing to understand that if you can give yourself 1 or 2 hours every day, there is very good statistical evidence from insurance companies that your lifespan can be extended by 20 years. So look at the huge benefit that you are getting. This is not something that I have told or not some doctors telling. These are data from insurance companies. Especially in London and all, they have published papers from insurance companies. They want to give insurance to people who have good lifestyle. They don't want to give insurance to people who do not have good lifestyle. And you will be surprised how good these insurance companies are. They were the first people in the world who told that high blood pressure is dangerous. At that time, Eisenhower's cardiologist, the American president's cardiologist, told the American president that BP is not dangerous. His blood pressure was 240 by 130. And of course, he died when he was in presidency. So what I'm telling is, insurance companies give us very good data. From their data, if you have proper lifestyle, you live longer by 10 to 20 years. The other problem, apart from being a developing country, is what importance the society and government gives to health. We spend around 1.5 to 2% of our GDP for health, our country, whereas the US spends around 18 to 20% for health. Their health expenditure is more than our country's total GDP. Our arms, everything put together, their just health is more. So basically, we don't think health is important. Until COVID came, many of them would not know, many patients don't know what is a heart, what is a heart attack, what are the blood vessels, and their nomenclature is all terrible, which means they'll say, ఏమైంది మీకు అంటే హార్ట్లో హోల్ ఉందండి, అక్కడ ఏదో స్టెంట్ వేసారంట, దాని తర్వాత ఏదో చేశారు. ఇట్స్ టోటల్ లైక్ మ్యాడ్నెస్. సో వాళ్ళకి ఆఫ్టర్ ద స్టెంట్ ఆల్సో దే హ్యావ్ నాట్ సెర్చ్డ్ ఆన్ ద ఇంటర్నెట్ టు సీ అసలు స్టెంట్ అంటే ఏంటి, రక్తనాళం అంటే ఏంటి, హార్ట్లో హోల్ అంటే ఏంటి, చదువుకోడు. Number one, he is afraid to read. Number two is he doesn't want to also. So the most important thing is avagahana. Once we know properly what is it that is killing us, the number one killer of mankind, how it behaves, we can prevent and predict it by 90%. Okay, next slide. So these are the differences in heart attack incidences between different countries. You can see India doesn't figure because we don't have proper statistics, but India is more than the East European countries also. There is almost a 30-fold difference between countries. For example, in Japan, their heart attacks rates are very less. Whereas in India and Southeast Asia, heart attacks are the most common disease. All throughout the world, if you compare, we suffer the most. Next. So there are four components of the heart. One is, what does the heart do? Basically, I want some interaction because after food, you know, sugar levels go up and the brain starts resting. Oh, the heart keeps beating, luckily, but still. So I want a mic to be given. Huh? Yeah, you're teachers, you must be good. What did you say? Correct. So it is the main transport system for the whole body. Huh? The vasculature, the blood vessels in the body run for more than 100,000 of miles. You know, such a huge network. Almost every cell gets its individual pal packet. Okay? It gets directly. So blood vessels are there even for individual cells. It comes to the doorstep. To maintain that transport system, we have only one pump, and that is the heart. So the main component of the heart is it behaves like a pump. And for that muscle to continuously beat, you have on the right top corner, you have 3 blood vessels supplying the heart muscle. You know, suppose the hand has 2 blood vessels. So the heart has 3. Can anybody guess the diameter of those vessels? ఎంత లావుగా ఎంత వెడల్పుగా ఉంటాయి అవి? అవర్ లైఫ్ హ్యాంగ్స్ ఆన్ దమ్. ఇఫ్ దే షట్ డౌన్ విల్ హ్యావ్ ఎ హార్ట్ అటాక్. ఎంత వెడల్పు ఉంటాయి? ఎనీ గెస్, ఎనీబడి? కరెక్ట్, వెరీ గుడ్. 2 to 3 millimeters. This is, you know, it's like a ballpoint pen refill or even smaller. And blood has to continuously flow in them. If it stops, there is a heart attack in that area. Means that muscle which supplies that area gets damaged. So that is the blood supply. On the left side, every time the heart has to beat, it has to be kick-started with electricity. Okay? Otherwise it will not beat. Everything else is fine, but if the electric signal doesn't come, it just rests. So for that, it has an electrical system. There is a small node-like thing on the right upper corner, which is called the SA node. From there, electricity is generated and it kickstarts the heart every time. Unluckily, if there is an electric short circuit, just like your bulb flickers, heart also flickers and stops. So that is called cardiac arrest. It is an electric problem. Most common cause of cardiac arrest is a heart attack. So in a heart attack, the blood vessels, the blood vessel gets totally blocked, one of them. You don't expect all three to block at the same time. So even if one is blocked, the heart will not stop all of a sudden because other two are working. But why does the heart stop? Because there is an electrical short circuit. When the blood supply stops, there is an electrical short circuit. And then the heart flickers and the person falls down unconscious. He stops breathing. If you can see there is no pulse, then you can do a CPR, cardiopulmonary resuscitation. And if there is a AED, automatic external defibrillator, it's called, every public place should have AED. What you do is you connect those patches, it will analyze the rhythm and say that please shock, press that button. If you press, what it does is it gives a shock so that all these electric short circuits are wiped out. Just like on your slate there is a lot of stuff, you wipe it out. Then again, fresh current starts. This is the main reason why most people of heart attacks die, because there is nobody to give them CPR and shock them, especially shocking. CPR is also not that helpful. The third component is there are valves. Valves are just like, you have a pump in your house. What do valves do? Unidirectional flow. They will not allow the water to come back. So in the heart also these valves cause unidirectional flow. Okay, so that it doesn't go back. For many Indians, they think the arteries are valves. They say, ma valve stent esarandi ani. Valves are different. Leకపోతే bypass చేసి 4 valves మార్చేశారని. Valves are different. And then of course the main thing that it does is a pump. Okay, next. So the inside of these arteries is lined by something called endothelium. It is like the pavement here. So that endothelium is made of cholesterol. Okay. So that is the reason why cholesterol starts getting deposited there, because it's a component of that. The main function of that endothelium is to prevent blood from clotting. See, the blood is such a thing that if there is a bleed or there is a crack anywhere, it clots. Otherwise, it will bleed to death. There are so many famous people who had diseases like hemophilia and all this. They bleed. The Russian emperors, their whole family had it. So small cut means they'll bleed to death. So inside the vessels, if there is a small crack or something, blood will clot. So to prevent that, this endothelium is there. Next. So starting from a very early age, age 2 years onwards, cholesterol starts getting deposited there. So and then gradually over the years you get those plaques. Next. And when the plaque gets around 80 to 90% narrowed, then only people start getting symptoms. That is the whole problem. See, if you are getting symptoms when it is 30% narrowed, more symptoms when it is 50, even more when it is 70, you could have nicely predicted all heart attacks. No. Till it is 80 to 90% narrowed, and only when you exercise. See, only when you exercise, your heart needs more blood because it is pumping fast. So this narrowing does not allow that increased blood to flow through those tubes. Only then you start getting symptoms. And then when blood clots over those narrowings, why does blood clot? Because, like I said, that endothelium cracks. You can see on the right side where there is a round, there is a small protrusion like thing, that is the crack. So when the endothelium cracks because of all this material that has gone underneath it, suppose this is the pavement, there is a lot of dirt underneath, the pavement will open up and then the blood will clot. So heart attacks are because of two things. One is the cholesterol getting deposited over 30-40 years slowly, and blood clotting suddenly. That is why heart attacks are sudden, although the process is a very slow one. Is that clear? Everyone asks, I'm okay, why did I get a heart attack? Because blood clotted. And blood will clot suddenly. Next. So this is a cut section of a smoker who died of a heart attack. You can see the lower one is the cholesterol material. The top one is the clot. And there where it says plaque rupture, that is the area where that endothelium cracked because of the pressure of this fat material. If you look at it, the lumen left over after the cholesterol material is there is still wide. More than 50% is there. So this person will never get any symptoms. Even if you make him do a treadmill test, it will be normal. Because, opening is still there. Only when that get clotted, it produced a heart attack. So this is the common scenario with everyone. Next. So this is what I was talking about. In a treadmill, they, make you run so that your heart needs more blood supply. And only if there is 80% narrowing in at least 2 blood vessels, it is positive. Otherwise, it's usually not positive. So many people say, when they come with a heart attack, 1 month back only I had full master health check. Everything was normal. So how come I got a heart attack? So this is the problem. You cannot predict this disease like that. Next. So this is the natural history. On the left, it is absolutely normal. Then the plaque starts building up. And you can see in the middle part, that is when the endothelium cracks and the blood clots. There the narrowing is not tight. As age passes, you get more and more tighter narrowings. That is in old age. We do angiograms, 80-90% narrowings will be there. They have no symptoms. Even if you don't do angioplasty, they are okay for under 20 years. So it has stabilized there. Whereas in the middle part, that is where you don't get symptoms, it is dangerous. So how to predict heart attacks? Next. So this is a wonderful test that is there. What happens is when cholesterol gets deposited, calcium also gets deposited. So you can check for the calcium by doing not a CT angiogram. This is a CT angiogram that they have shown. Next slide, please. This is a CT calcium score. It just looks at the calcium. The radiation is just like one X-ray. It hardly takes 5 minutes. If the calcium score is 0, your chances of heart attack is almost 0. If the calcium score is more, you know that cholesterol is getting deposited. So this is a very good test. We advise everyone more than 40 years to get it done. We have a coupon for around 1,000 rupees each calcium score. It's done in our housing board branch. You can take it and utilize it. Everyone more than 40 years, it's better to get it done once. Go back. CT angiogram is where you can actually look at the blood vessels. They inject dye, the radiation is more. So we are not advising this test for everyone. But the CT calcium score is very easy to do. Next. So there was a study done called the Interheart study. This was done by Indian. This is the largest medical study in the world till now. It's done by Dr. Salim Yusuf, who migrated to Canada. Next. So he looked at these simple things. Can you use these things to predict heart attacks? What are they? Smoking, high blood pressure, high sugars, high cholesterol, high weight, lack of exercise, lack of fruits, vegetables and fiber in diet. Then depression, not anger but depression. And alcohol, or rather lack of alcohol, but whatever, we are not going to touch alcohol, the rest of it. So he found that he can predict 80 to 90% of heart attacks by just seeing if people have these problems. If they don't have any of these, the chances of heart attacks are very minimal. But we don't use this. We all know. Next. So there are some markers for heart attacks, like diabetes is a marker for heart attack, which means if you have diabetes, the chances of heart attacks are 4 times more already. So they all need to be treated as if they already have a heart attack. So that's very important because huge number of diabetics in India. Next. And there are some non-modifiable risk factors, like males are more prone postmenopausal. Ladies are protected as long as they're menstruating. Once menses stops, their heart attacks are more than males. So ultimately it is the same. And then family history is very important. If you have a family member who is less than 55 years in your family who had a heart attack, you should be very careful. And diabetes also is, we have put under non-modifiable because even if you control sugars well, heart attacks don't decrease. You have to decrease cholesterol. Next. So we'll go one by one. Next, smoking, no one is. Alcohol, let's not talk about it. Menopause, anyway, we know that, once we have menopause, it's dangerous. Diabetes, next. See, people ask, how did I become a diabetic? See, this is a simple internet calculator. If your score is more than 10, you are at high risk. See, if you are overweight, 5 points. If you are not exercising, 5 points. Age, with increasing age, you get more points. And if you are Asian, you get 4 points automatically. Huh? So, which means that all of us are very prone. Especially ladies in India. Next, because 60 to 80% of ladies in India are obese. Because we don't wear pants and shirts. If many of us try wearing pants and shirts, then we'll know how obese we are. So, next we'll come to high blood pressure. So, what is a normal blood pressure? Above what is hypertension? So, more than 120/80 is hypertension. So, your blood pressure, lower blood pressure should not cross 80. Actually, there is very good evidence from 110/70 or 75 for every 20/10, heart attack risk double. So then why we have put 120/80, why not 110/70? Because there will be a huge uproar. When the American Heart Association lowered it from 140/90 to 130/80, a lot of nonsense happened. Everybody started criticizing. They said, the lobby, there is this hypertension company lobby, sir, what is doing all this? But it is there, the evidence is there since last 20 years that 110 or 115/70 or 75 is the normal pressure. Above that, heart attacks increase. So you can check, many of us have 140/90. So compared to 110/75, if my blood pressure is 140/90, my heart attack risk is 3 to 4 times more. So what should I do? Get worried about it. We'll talk about it. So next. So there are a lot of lifestyle modifications that you can use. If you reduce weight, even if you are not overweight, blood pressure will drop quite significantly, 5 to 20 millimeters. So many people can come off drugs also. There's a DASH eating plan. It is almost an Indian eating plan. A lot of nuts, non-fat milk, vegetable oil, lots of plant food, less non-vegetarian. Similar to Indian food only. If you decrease salt, the salt that is allowed is 1 pinch, this much. So most Indians consume 30 times. Huge amount of salt, and the kidney is always trying to excrete that salt. And ultimately in 50% of people it is not able to do that. So blood pressure increases. So how to avoid salt? Pachadu. All the jar pachadu which they are full of salt. Then the extra salt that we use. And then I was brought up in Orissa, there a lot of people do not put salt in the curry at all. They have put some salt extra in the plate, and this guy is eating, and then he's just, that's all like, and he gets the taste of the salt. They don't put salt in the whole thing. And then all these fast foods, they have MSG, monosodium glutamate, very high in salt. So we have to be careful because salt is a very dangerous thing. Then physical activity, if you exercise, it will reduce. Alcohol, if you decrease, not there in this slide is yoga. If you do pranayama meditation, within seconds, your vascular resistance comes down. Vascular resistance means, Ohm's law? So the blood pressure that needs to be maintained depends on the resistance of the blood vessels. So those things open up, those small blood vessels open up when you mentally relax. When you get stressed, they immediately close. So the blood pressure keeps increasing if you are stressed out. So if you can relax and then gradually go into that relaxed phase all throughout the day, which is possible, your blood pressure can be lowered by 10 to 20 millimeters mercury.